In order to avoid being caffeine addicted or addicted to caffeine, we need to know how much caffeine is in our coffee, the coffee we consume, and also we need to know how much to drink. How much is it safe to drink per day? There are many types of coffee around. The most famous ones are two, Arabica and Robusta. Arabica, origin from Ethiopia, as they say, or Abyssinia, or some people say from Yemen, and the other one, Robusta, from Congo. What is important for us now is to know the amount of caffeine in both. The caffeine in Arabica, and you can see the difference in shape and of the coffee. The Robusta is slightly rounded, and there is one straight line in the middle. However, the Arabica is slightly oval. 1.5 to 2.3% of the coffee is caffeine in Arabica, and it's double in Robusta. 3.3 to 4.1 of the amount of the coffee is caffeine. And there are so many types of roasting degrees, and increased roasting will create more chemical reactions. Therefore, many things will go out of the coffee and many things will come, it will be made during the process. When we increase roasting, longer time, will become more bitter or more bitterness. We will have more bitterness in the coffee. Increased roasting, less polyphenols, and also will be less caffeine. The more we roast it, it will be less in caffeine. Increased roasting also less acidity, because coffee is slightly in the acidic side, not in the alkaline. However, I prefer to have it mixture. When I go and buy my coffee, I'll ask him to mix non-roasted, slightly roasted, half roasted, and the dark one. The taste will be wonderful and nice. Hello, everyone. This is Dr. Ali Qassem, and this is another episode regarding coffee. Many sources say that the amount of caffeine is 300 milligrams per day. I said no, to be in the safe side. You can't take, or you shouldn't take, more than 200 milligrams per day. And for pregnant women, between 75 to 100. And better if you just stay away from it. Just take one small cup will do. You don't have to take so much just to protect your baby. If we talk about decaf, there is caffeine. It's not completely without caffeine, but the amount of caffeine is very little. It's 3 to 7 milligrams in a cup of 200 milliliter. The Arabic coffee, the one Arabians used to drink, just one sip or two sips, is very little amount. The amount there is between 12 to 15 milligram of caffeine, and it's safe. Arabs used to drink almost all day long. Maybe sometimes people will take 10 to 12 cups per day, but I advise not more than 5 to 6 cups per day from this type of coffee. The Turkish coffee, the cup is around 50 ml, 50 milliliter, and it contains between 50 to 65 milligrams of caffeine. Espresso, it has 75 to 85 milligrams of caffeine in just a small glass that is 40 milliliter. It's very high in caffeine. Instant coffee, with the majority of the brands, between 55 to 65, and normally it's mixed from Arabica and Robusta. I don't have to mention the brand of the coffee, but majority of them between 55 and 65 milligram in 200 ml cup, all the instant coffee. All the popular brands, or majority of them, if we take 200 ml of coffee, it contains between 150 to 310 milligrams of caffeine. It's very high, slightly high. Some of them are really, really high. A question: should we drink regular or instant coffee? It's up to you. It's up to you. You adjust it according to yourself. Sometimes, or most of the time, I can't take the regular coffee. I use the instant coffee. Even though some people say it's very dangerous or harm, I don't see any harm. I've been drinking this coffee for almost 10 years, 15 years. I did not see any side effects for it because last time I used to drink really heavy, too much of that coffee or the instant coffee, but now I reduce it to 2 to 3 cups per day. My friends, we have to be so careful with what we consume, either food or drinks, etc. We should know what we consume. I would like to thank all our family members, those who joined the channel, and I also would like to thank those who are going to join. Thank you with my heartfelt gratitude. For those who see me for the first time, my name is Dr. Ali Qassem. I am not a physician. I discovered that I have diabetes in 2007. I started taking my medication in 2011, And by the year 2017, I ended up with 4 medications: metformin, Jardiance, Diamacron, and Trajentadol. And the medication did not do any well, or did not make any well for me, anything at all. In fact, it destroyed my body, and no improvement in diabetes. So I decided to stop taking my medications completely. And since then until today, almost 6 years, I did not take any medication, and my sugar level is under control. My cholesterol level, my high blood pressure, everything is under control. And I have studied almost everything I ate and everything regarding diabetes for the last 6 years. And I will share all the information that I learned with you all. I hope you like this video, and if you like it, please share it, because sharing is caring. And if you have not joined the family, please join the family. And I promise you, you will not regret. In this channel will be information, scientific information about everything we consume and everything regarding blood pressure and diabetes. I would like to thank you for watching. Thank you so much. And I wish to see you in the next video with my heartfelt gratitude.